Today we are having a hearing on cybersecurity in the health and education sectors. I will have an opening statement, followed by Senator Cassidy, and then we will introduce our witnesses. After they give their testimony, senators will each have 5 minutes for a round of questions. And again, while we were unable to have this hearing fully open to the public or media for in-person attendance, live video is available on our committee website at help.senate.gov. And again, if you're in need of accommodations, including closed captioning, please reach out to the committee or the Office of Congressional Accessibility Services. Every day, students, educators, patients, and healthcare providers across the country rely on countless programs and IT systems to learn with online tools, to get a prescription, do a telehealth appointment, and so much more. It is easy to take for granted how critical technology is to fundamental tasks like collecting and protecting the personal data of students and patients, keeping track of course requirements, lesson plans, student financial aid, or providing information about prescriptions, allergies, and surgeries, information with potentially life and death consequences. And during the past few years, COVID-19 has made technology even more central in healthcare and education as patients and providers have made greater use of telehealth services to make care accessible, and schools are helping close the digital divide by connecting students to the internet and devices. With that increased reliance on technology, we must also increase the attention given to the challenges that technology present. A critical part of that is closing the digital divide and ensuring all of our communities have access to the internet, which is why I fought so hard to invest in universal broadband and digital equity in our bipartisan infrastructure law. But we can't just call it a day after we make technology easy to use or access. We need to make sure it is also safe and secure. We need to address cybersecurity attacks and ensure they are treated like the national security threat they are, because cyber attacks are on the rise. In 2020, 70% of hospitals surveyed said they had faced a significant security incident within the past 12 months. And between 2016 and 2021, there were over 1,300 school cybersecurity incidents in the U.S., and that's just counting the ones that were publicly disclosed. In my home state of Washington, we know that there were at least 44 data breaches in the healthcare sector last year and at least 35 in education. And the number of cyber attacks in our state overall increased significantly from 2020, with the number of large-scale attacks affecting over 50,000 people having tripled. During this pandemic, we also saw hackers infiltrate our state's unemployment insurance system, a breach that exposed the information of over 1 million people across my state. These attacks can come from a wide variety of sources: individual hackers, organized crime, and even hostile state actors, as we have seen most recently in Russia's invasion of Ukraine. This is a serious national security threat, and families need to know we are taking action to keep them safe from our enemies here. Because we know our biggest global adversaries, Russia, China, North Korea, Iran, have been putting resources into sharpening their cyber attack capacity. And cyber attacks can also take a wide variety of forms. Data breaches that expose sensitive information from health information adversaries might use to threaten national security, to private financial information about patients, students, and staff. Distributed denial of service attacks that can be used by hostile countries and others to make computers and networks unresponsive and shut down services. Or ransomware attacks, where foreign actors or other dangerous organizations hold essential services and data hostage unless a large financial ransom is paid. And even when a hospital or a school is doing everything right, there are always new threats they may not be able to be prepared for. And every organization is still vulnerable to attacks on the tech vendors that they rely on. For example, a 2019 cyber attack on Pearson affected over 13,000 students, and a breach at another education vendor last year, Blackbaud, exposed the financial information of 17,000 students just from my home state of Washington alone. The fallout from these attacks can be devastating and wide-ranging. Hospitals can get locked out of the electronic healthcare records they need to understand a patient's condition, or software needed to schedule surgeries or track prescriptions or get lab results and divert ambulances. I have even heard from health departments back in Washington State about how responding to cyber attacks has pulled resources and staff from their COVID vaccination efforts. These kinds of challenges don't just cause major headaches or lawsuits and expenses. They put patients in danger. They undermine our national security, and in some cases, they even cost lives. Meanwhile, our schools are at risk of getting locked out of online programs that students use to get and turn in assignments, or teachers use to post and track grades, and administrators use to lay out courses and schedules for the semester. Hacks can disrupt routine functions like payroll and can leave patients, students, and staff exposed to identity theft. And that can be especially concerning for K-12 students, as it often isn't clear to students or parents that a child's identity has been stolen until they try to open a bank account or request student aid, which may not happen for several years. Cyber attacks also have huge implications for our country as a whole. They can undermine our competitiveness on the world stage, and the possibility of a cyber attack coordinated by our enemies to take out healthcare facilities, especially at a moment of crisis, is a serious threat. So we have to make sure we are ready and vigilant. That's why I'm glad President Biden signed into law legislation we passed to require more reporting of cyber incidents and to study the impact of cyber attacks on K-12 schools. It's why I am now watching closely as HHS works to strengthen its information security systems and as ED works to help protect K-12 schools from cyber attacks. And it is why today's hearing is so important. I want to hear from all of our witnesses about how we can address urgent challenges, like how do we recruit, train, and retain more cybersecurity experts, especially in the health and education sectors where there is a big shortage. What are some best practices that schools and healthcare providers should be implementing? And how can we better connect organizations to share information like this that will help prevent, mitigate, and respond to cybersecurity incidents? How can we improve disclosure of cybersecurity incidents so people will know when and how they've been affected by a hack, what they might do about it, and how can they protect themselves? And what are we doing to prepare for attacks from hostile foreign actors? How do we make sure we don't just keep up, but keep ahead of Russia, China, North Korea, Iran, and others? It is especially critical to me that we are treating cyber attacks like the national security threat we know they are. These are incredibly important questions for families back at home in Washington State and across the entire country, whose privacy, finances, futures, and even lives depend on making sure we have good answers and take clear steps to put them in practice. So I look forward to hearing from all of our witnesses today about these issues and really appreciate all of you being here.